let's first go through this first one. Talk to me kind of the way I want you to read me through this is kind of how you work through it, what you were thinking, how you got to your answer.
Okay, so let me just reread it for a second. Okay, so the first thing that I thought about was just looking at the curve because of where the Z point is. So you can see on like the pH point that it's a form of alkalosis because the pH is greater than 7.4. So that kind of helped me rule out the ones I crossed out kind of. And then I was thinking about metabolic alkalosis because um I don't remember my logic. I think I saw that the H plus was low. So then I thought that was some form of like compensation for a metabolic alkalosis.
Okay, so
But
let's talk about this on yeah, I get where you're going for. I'm gonna make this, remember, I'm all about making this as easy as it can, right? So hold on. I'm gonna disconnect something. Give me a second and use a mouse because it's hard for me to draw with this mouse pad. So I need to figure out which one's which here. Is it this one? Okay, perfect. Okay, perfect. All right. So now draw maybe 50% better or 20% better. Okay. So let's talk about some key factors here because remember, I'm all about teaching, teaching one thing to get you multiple questions, right? So let's start out first, what's the normal pH?
7.5 or 4, sorry.
7.4, right? Some people say 7.35 to 7.45, okay, is normal range, okay? How about P partial pressure of O2?
I don't remember the exact. I think I have to look at the value.
So I want you to remember these, okay, because it's going to save you a lot of time. Okay, so PO2 is 100. Okay, what's PCO2?
40
Yep,
or I
40. Good. Okay, and then bicarb HCO3.
think that's 24.
Yep. Okay, so let's talk about this. Okay, so the way I always start out with acid-base problems is you need to figure out are you acidic overall or are you alkalotic overall, right? So you went from Y to Z. Z is over here, right?
Mm-hmm.
So if you look at the pH, right, you're at 7.6. So is this acidotic or alkalotic?
Alkalotic.
Okay, alk. Okay, good. Okay, so now you know that overall the issue has to be some kind of alkalosis, correct?
Yes.
So now let's talk about this, okay? Don't look at the chart anymore. Look at kind of our numbers here, okay? If it's PCO2, okay, if it's a primary respiratory alkalosis, okay, what would the PCO2 value be?
Probably lower.
Probably lower, right? PCO2 is less than 40. Does it make sense? If it's
Yes.
primary, right? How about if it's primary metabolic alkalosis? What would the HCO3 be?
Higher.
Higher, right? Okay, so HCO3 is greater than 24. Okay, so now we kind of understand, okay, it's either one of these things. Let's think about that like that, right? One of these things, right? So if you look at Z, okay, we already know the pH. Now let's kind of go across here. Okay, let's just assume that this is somewhere like 18. Okay, so bicarb is 18. And let's look at the curve that it's on, which is 20, right? Which is the PCO2 is 20, right?
Yes.
PCO2 is equal to 20. Okay, and then HCO3 is equal to 18. So right away, can if the HCO3 is low, then you know it cannot be metabolic alkalosis, right?
Right. Mm-hmm.
Okay. Ingestion of an acid can't be right because we're alkalotic overall. Okay. And then a high CO2, right? If a high CO2, that can't be right because that's the acidotic, respiratory acidotic. So we get between these two, right? Breathing air at 2 atmospheres of pressure versus breathing a gas with low PO2. So what is this kind of, if you think about a clinical setting, what does this mean if you have low PO2? If you give me a clinical setting where there's low partial pressure of oxygen.
Maybe like hyperventilation or like at a high altitude.
Yeah, high altitude. That's what they're trying to say, right? When you're thinking of these problems, you're trying to convert it into a clinical setting, right? So low PO2 is high altitude, right? And if you're at high altitude and you have low O2, you're going to breathe faster, right? If you're going to
Okay.
breathe faster, then your PO2 is going to drop, right? So it's actually a respiratory alkalosis with metabolic compensation. Does it make sense?
Yes.
So that's why B is correct. But you get kind of the tree of logic that we went through, right?
Yes.
Okay, start with the pH, figure out if you're overall acidotic or alkalotic, right? Then after that, you have to ask yourself, are you in metabolic, right? Or is it primary metabolic issue or primary respiratory issue, right? And then
Mhm.
from there, understand what is compensating what. And so that's why I said it's so key to understand these values, right? You have to memorize these values because if not, then when you look up a chart, then it's going to be really confusing. You're looking at two charts, right? You're looking at one chart here, one reference chart. You know what I mean? So try to
Right.
use this thing. Does that make it a little bit more simpler?
Yes, it does.
Okay, so if they were, let's take this to completion, just so I can test kind of your understanding of this concept. So,
Sure.
what do you think the respiratory rate is going to be? Is it going to be high or low?
High.
Yeah, high, right? So remember the respiratory rate, this is super important too, is 12 to 20 is normal rate. So this would be probably like 24 or something like that, right?
Yes.
Okay. So I'm just giving you these tidbits so that, I want you to be a master of acid base. So next time you don't, whether there's a graph or not, you can kind of work through that pretty easily. Okay.
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 Okay. So for this one, I think part of it was just I haven't reviewed biostats in a while, but I chose B because I thought that that would give the maximum like true positives.
Okay, so I'm gonna talk to you in clinical senses because
Yeah.
my biochem, like how do I mean biostats, when you're talking about definitions is very shaky because I figured that memorizing that stuff back in the day it just never stuck, right? So the way
Right.
I teach biostats now is very clinical. Remember, I'm gonna push you towards the clinical aspect of things, right? So let's talk about sensitivity, okay, versus specificity. Okay, give me a symptom or a scenario where something is very sensitive.
Mm,
Maybe I didn't lead that question better enough. Let me kind of clarify.
okay.
Sensitivity, okay, is anything that catches almost everything. Okay, so just imagine if you were a fisherman, if you wanted to catch as many things and be sensitive, it's going to be a huge net, right?
Right.
Okay, so give me kind of a symptom that is very sensitive but not specific. So it just
Fever.
yeah, fever, right? If you say someone has a fever, you can't tell me if they have a bacterial infection, a viral infection, cancer, they ran a marathon, right? The list goes on, right? Your temperature is very high because you're sick, right? It's sensitive, right? That's why, if you remember, I always say, maybe you don't remember, but in the COVID era, right, which is probably after your time in med school. But in the COVID era, right, before you can enter the hospital, they always got blasted with a temp. And the reason why is if you have a fever, they're like, I don't know if you have COVID or not, but you're going home. You get what I'm saying?
Right.
So
Hmm.
very sensitive, right? Specific. Give me something that's specific.
Maybe like a specific antibody for
Bingo. That's exactly like, for instance, I don't know, like
strep, maybe.
yeah, strep. Okay, let's say strep. Strep is a good one. Strep. Okay, if you're strep positive, that's hella specific. That means you likely have strep, right? But if you have a fever, it doesn't mean you have strep, right? It just means you're sick. Okay, so now that we understand clinically, right? So let's kind of convert that, right? Remember, sensitivity catches everything. Specificity is very specific for one disease. And another way to help you remember specificity are those are your quote unquote buzzwords. Does it make sense?
Yeah. Okay.
Because they're so specific for that disease. So you're looking for those buzzwords, right? But as you already know, right, they're kind of slowly leaning away from that. So now they're asking you the letter decision points will produce the maximum sensitivity, which will catch everything for the detection of the disease. So you want to catch all of this, right?
Okay.
The best way to catch that is if you catch this. right? It's very sensitive, but not specific. So A would be like a fever, right? Let's say like, oh, he has a fever, you catch the disease, right? Doesn't mean that it's specifically for this disease, right? But it is, disease.
Mhm.
B might be something like something a little bit more specific to the disease is fever, let's say plus, whatever it is, a cough or something, right?
Right.
Okay. And then C would be very specific, but not sensitive. So C would be something like, maybe an antibody for the disease, right? And they'll always test you only these first three letters.
Okay.
Okay. But does that make sense why A is the most sensitive?
Yes, it does.
Okay, perfect. So now I'm going to give you another test taking strategy, right?
Okay.
Um, B is a bad answer. The reason why B is a bad answer is right in the middle, right? They never
Mhm.
test you right smack dab in the middle on these tests because it's very difficult to, right? So if you didn't know, you have to pick between A and C.
Okay.
Does it make sense? And
Yes.
same thing with things that they're saying like sometimes they ask you like anything, right? I'm just giving you an overarching test taking strategy. It's always the lowest or the highest. It's never in between. Does it make sense?
Yes.
So that will make you 50-50, right? Don't pick something in the middle because it's hard to pick something in the middle. Like it's hard to test that, you know what I mean? Like
Yeah.
fairly. But it's very easy to test your extremes, like high or low, right?
Right.
Okay. I'm just giving you some cheat codes in case, sometimes you won't know everything, right?
Mhm.
So give yourself the best chance. All right, let's go to the next one here. Oh man, this is definitely I can say I can't give you too much of this. This is a memorization thing, right?
Yes.
So this is just kind of that biochem, right? You gotta know your lysosomal disorders. Do I personally remember these now? No, definitely not. No way in hell, right? But I would say that when I did take step one, I remembered, forwards and backwards that kind of diagram chart in first aid, right?
Yeah.
What enzyme leads to what, right? What deficiency of what enzyme is for what disease, and then also you're gonna want to know symptoms of each disease, right?
Yes.
Yeah, because some of them will have, heart issues, right? Some of them would have muscular issues, right? Some of them would have a cherry red macule, right? Stuff like that. So, all right, this one here.
Mhm. So for this one, I knew it was like an MCA stroke, just based off of the scan on the left side. So I thought about aphasia because it's in that region, but I guess looking back at first aid, it does depend on, or sorry, I thought spatial neglect would be impacted, but looking at first aid, I realized that like I guess the infarction that occurs on the dominant side, which is usually that left hemisphere, is associated with aphasia.
Okay.
It's the right side.
Um, yeah, so working through this, right? I mean, when I look at this, right? I mean, um, I'm looking at the scan, right? I think I talked to you about. I'm trying to give you extra tidbits, right?
Yes.
I remember talking to you about imaging, right? So if you look at this image, right, and you split it in half, right? Obviously, they give you this is the left, this is right, which is nice of them, but it's always like that on scans, right? And you see this whole area is just black, right?
Right.
So in my mind, right, I'm like, oh, that's really freaking bad, right? That's almost one whole hemisphere. Okay. So this is the left side, so it controls the right side of the body. So that's not right. Spatial neglect. I cannot remember what part deals with spatial neglect. Weakness of all muscles facial on the right hand side. Weakness of lower two-thirds of the face on the left. I also can't remember that, but noting on the left side, you remember that that's where a lot of your speaking is. So I would kind of narrow it down to aphasia. But one of the things that I kind of always do is some of this you have to kind of work through and ask yourself, what you can remember. But when it comes to something this big, right? I'm thinking of something like heavy, right? It's not going to just be face, right? But it's going to be kind of practically all of the patient's right side besides his feet, probably,
Yeah.
right? But yeah, so that's kind of how I would work through this. Like I said, there are some details that you have to know about, but I can't remember where spatial neglect is, and I don't think you're often asked about spatial neglect.
Okay.
So, All right. Work me through this one here.
Okay, so for this one, I think I just didn't, for some reason, register that it was iron deficiency anemia.
Okay.
So I picked F because I knew at least, yeah, I just picked F because let's see, it's in reference range.
Okay. So let's work through this together. Okay. So okay, 28-year-old male. He's young, right? Routine health examination. He's from Jamaica. He practices this. Diet consists of only natural fruits, juices, fruits, and grains, correct?
Yes.
So what is that to you? That's what, vegan, right?
Yeah.
So he's vegan. Okay, so you have to kind of understand that he's vegan. Marijuana, sure, doesn't really deal much with this, right? Physical exam, no abnormalities. Hematocrit is 32. Do you know what, how to convert hemoglobin to hematocrit or vice versa, hematocrit to hemoglobin?
No.
Okay, so I'm pretty sure it's hemoglobin times 3 is equal to hematocrit.
Okay.
Okay, so if you divide this by 3, then it should give you your hemoglobin. So hemoglobin right now is around 10, right? 10 and 2/3, right?
Yes.
Okay, so he's anemic. So you know he's anemic, right? And then, right, one of the things that you worry about being vegan is not folic acid deficiency, but B12, right, deficiency. But they say that B12 is within normal range, right?
Right.
So now the question is, all right, so what kind of anemia can somebody that just eats juices, fruits, and grains can get, right? So remember, a lot of your iron, right, is from meat.
Yes.
So in your mind, you're like, oh, okay. So he has to, in your mind, you have to be thinking the diagnosis, right, is iron deficient anemia. Okay. So always think about your diagnosis first. Don't look at these, right? Your diagnosis, once you get your diagnosis, then you want to fit your answer to your diagnosis, right? And the answer that you chose was 10% sickle, but he had no family history of sickle cell anemia, right? They didn't give you any of that, right? So in your mind, sickle cell should be very far from that. Does that make
Okay.
sense?
Yes.
Okay. Because this would be like sickle cell trait, right? But here looking at, right, so iron deficiency anemia is microcytic. So, right, so you have 4 answers there. Shape is normal, right?
Mhm.
Because you don't change the shape of it, it's just smaller, right? And then it's going to be pale because you're missing that iron component, right? So,
Right.
um, I forgot the term. What is it called? What's the heme term for
Like hypochromic or
hypochromic? Exactly, hypochromic. Bingo. Okay, it loses that color. Do you have any questions about that?
no. I think I was on the right track and then maybe got confused with all the answer choices.
Sure, sure. So my thing is, Michelle, looking at these questions, right? I want you to commit to a diagnosis. Okay,
Okay.
that is my goal for you this week. Okay, the week is, even if you miss every question that you do, I know that sounds daunting, right? You're doing practice questions, you're missing everything. I want you to focus, how many times did you get the diagnosis right? That's what matters to me. If you start getting diagnosis right, it's very easy to get from here to here, right? But if you are trying to go from here to here and you're skipping this step, it becomes very difficult.
Yeah.
Okay.
So
So
would you recommend trying to like figure out what the diagnosis is before even looking at the
answer choices, 100%. Like, I mean, not before but because remember, I still want you to read the question, skim
Yeah.
over the answer choices, but after you read the case, you should be like, okay, like if I'm working through new questions with you, I want you to think to yourself, okay, the diagnosis is this, right? Let's say, I'm gonna put a question mark, right? Because the diagnosis is this, I know the quality traits of this diagnosis is this. That's the logic that I want you to work through.
Okay.
Okay. Because I think right now when correct me if I'm wrong, but it seems like you're kind of going from here to here and you're not
Yeah.
committing to a diagnosis, meaning that it's difficult, right? Because what's happening is probably when you're reviewing, you're getting the diagnosis after your review. So then you're connecting the dots back like this. You know what I mean?
Yeah. I
So
think that's what's happening.
and that can be very frustrating. You know what I'm trying to say? You're like, oh, I was so close, right? All this stuff, right? But really, right? My thing is, in my mind, you're very close to the answer if you get the diagnosis. Even if you get the diagnosis and pick something like this, then it's easier to make this connection. Like, oh, yeah, I forgot that it's pale, small, and normal. You know what I mean? That's very easy. So
Okay. So for this one, I knew that it was going to be a parietal cell that releases hydrogen ions, but I just didn't recognize the histology of it.
that's okay. This one is, this is you kind of learn from it, go fast through it. Does it make sense to go faster? It's like, okay, so I got the diagnosis right, right? I'm okay with that. Remember, you got the diagnosis right. Oh, on a histology is kind of this more pinkish color, right?
Hmm.
And then you
Yeah.
kind of move forward. Okay, work me through this one here.
Okay. I'll read through it first. Okay. So for this one, sorry. I thought it was going to be like a thyroid problem,
Okay.
some like difficulty swallowing, history of Graves. Um, but let's see. I think what threw me off was just like the prolonged QT interval.
Okay. So I'm gonna work this through with you, okay? And then I want you to kind of see how I'm thinking through questions and how I want you to think through questions, right? So which of the following is the most likely causes patient's new symptoms? Read this, right? I'm looking through all of this. And in my mind, I'm already thinking that this is an endocrine slash thyroid or parathyroid issue, right?
Mhm.
I've narrowed it down in my mind. 33-year-old woman, middle-aged female, that's what I'm thinking, comes to vision because of 2-week history of fatigue, difficulty swallowing, and paresthesias of her lips and her fingers. Paresthesias meaning like tingling, right? And in your mind,
Yes.
you're trying to convert it. Tingling of the lips and fingers. She also had episodes of painful wrist spasms during this period. So it's some kind of, so in my mind, it was like muscle issues, right?
Mhm.
Muscles, nerves, okay. She has Graves' disease and underwent a surgical procedure to remove part of her thyroid gland 3 weeks ago. So in my mind, right, she had surgery and now she's having issues after the surgery. So in my mind, she's having complications from her surgery. Does it make sense?
Yes.
Her only medication is low dose propranolol, which is a beta blocker. Okay. Vital signs are normal. So that means that she's not acutely ill, right? Like, as in kind of critical, right? Physical exam shows no abnormality except a well healing incision of the neck. ECG shows prolonged QT intervals. So I know that there's some kind of cardiac issue. Okay. Which of the following is the most likely cause of this patient's new symptoms? So in my mind, right, I'm thinking that it's a timeline. She had surgery of her thyroid. Okay. And then after her surgery, she has nerve issues, she has muscle issues, and then the conduction of her heart has issues, right? So
Right.
in your mind, you have to be picking what diagnosis deals with all of these, right?
Mhm.
Okay. So the only thing that can deal with this is some kind of an electrolyte abnormality. Does that make sense to you?
Yes.
So she probably has hypocalcemia, right? And the only way you can have hypocalcemia after thyroid surgery is if you ding your parathyroid glands. So you have hypoparathyroidism causing, right, hypocalcemia, right, causing paresthesias, right, causing muscle spasms, right, and
Mhm.
causing cardiac issues because your electrolytes are abnormal, right? But remember, hypothyroidism, right? What are the symptoms of hypothyroidism?
Probably you would see things like cold intolerance.
Good. So cold, right? You're going to gain weight, right? Right? You might be bradycardic, right? So all these things, right? I want you to connect them clinically. You know what I'm trying to say? I think what's happening is, would you say that if the way I work through it, it makes the question a little bit more black and white?
Yes.
Yeah. So, and even you even knew the symptoms of hypothyroidism, right? You told me all these things, and it doesn't fit any of the stuff up here, right? Right.
Mhm.
Okay. Questions about that?
Um, no, I think I'm like making the same error in terms of like looking at the answer choices without like thinking through the diagnosis.
Exactly, exactly. That's going to be a big portion of, and think about this, Michelle. So imagine this, you're already scoring a 55, right? Even though to you, you're like, oh, that's not good, right? But think about this, right? You're already scoring a 55 without even doing the correct, the correct way of working through a problem, right? You're trying to pick an answer and go directly to the case, right? Without diagnosis. So if you work on the diagnosis standpoint, it's going to be very easy. You're going to make a big jump. Does it make sense?
Yes.
Okay. But do you see how kind of what is this? What happened? But do you see how going through these questions, it's not really about right or wrong, right? To me, it's really about how you work through the question, right?
Right.
Because that to me is way more important than how you got it right or wrong. Because if you've been getting questions right by kind of working backwards, then you are kind of handicapping yourself in the future, So
Yes.
okay, work me through this one here.
So for this one, I picked Giardia because I had never really seen cryptosporidium in the context of like an intestinal slide, you know. I've only seen it with an acid fast stain or something like that. And so I was expecting more of the appearance of like a oocyte, but
Okay.
yeah, it's Giardia.
Sure. So I'm once again going back to this clinical thing I keep mentioning, right? And you're gonna hear me say that a lot because I'm gonna push that on you, right? So starting again, which of the following is most likely causal organism? So you know this is a micro question right off the bat, right? 24-year-old man, right, young male with AIDS comes to the physician for 1 month history of abdominal cramps and watery diarrhea. These symptoms has increased severe during the last 5 days. Pulse ox is fine. He is dry, right? Obviously, if you're, having diarrhea, and then you have this specimen of the colon. Okay. So now my question for you is, let's imagine that this doesn't exist.
Right.
Can you answer this question?
I think I would be able to narrow it down. Yes.
Okay, so let's talk about it, right? So young male with AIDS. Okay, that's what you need to start out with. Okay, that has abdominal cramps and watery diarrhea. So when does giardia usually happen? Like, give me a clinical setting that points you to giardia.
Like being around fresh water or
Yeah,
drinking
like
contaminated.
hiking, camping, fresh water, right? They don't mention any of that, right? Does it make sense?
Yes.
So if they don't mention any of that, then even you see what I'm trying to say, right? Is that you're picking answer choices because I think you're looking for buzzwords or you're looking for something specific on the slide, right? But you're not looking at everything else, right? So they don't tell you that he's a hiker. They don't tell you anything. The risk factor here is he has AIDS, right? You didn't learn that giardia happens with AIDS, right? So that can't be it, right? CMV can happen to AIDS, right? But mainly it's going to be either bloody diarrhea. You're going to have, esophageal ulcers. You can have, CMV pneumonia, things like that. So not the case here, right? Cryptococcus neoformans. What is this? This is
It was
like a fungus, right?
already, yeah.
Yeah. So and then Canada, right? Canada is like yeast in your mouth, right? Yeast infection, things like that, right? And then MAC complex. What kind of symptoms do people in AIDS that have MAC?
Kind of similar to like pulmonary.
Yeah, pulmonary, like some pneumonias, things like that, right? So unlikely, right?
Mhm.
So now, right, you're kind of looking between these, right? And as you can see, right, cryptosporidius is usually the one that's going to cause you that watery diarrhea, right?
Right.
That's the
Mhm.
common cause, right? Cryptococcus neoformans is going to give you like meningitis stuff, right? And then also some lung symptoms.
Mhm.
Okay, so where in this kind of when I worked through this, where did I say, hey, what does this show, right? You know why I did that on purpose, right? Because the majority of the times, right, people get so fixated on imaging that they can't see or understand that you can answer this question without the imaging,
Mhm.
right? If the imaging is there and you know it, then of course, But to be honest with you, like as a tutor, right, and I've done this for a long time, I can't look at this and tell you exactly what I'm looking at, right? I'm not like the best pathologist in the world, right? But I can tell you that this is 100% C without looking at this, right? Um, So yeah, you can add this onto your repertoire and kind of, pattern recognition, be like, okay, this is what kind of cryptosporidium looks like. Yeah, sure. But the key is really it's AIDS with watery diarrhea for a prolonged chronic time. That's going to be, cryptosporidium until proven otherwise. You know what I'm trying to say?
Mhm.
Questions about that?
No, I think I picked cryptosporidium first, and then I looked at the image, and then I changed it. So that was
Yeah.
probably another
So,
mistake.
so my thing I always say is this, right? Like, unless you're 100% sure, right? And you'd be like, oh, it's Giardia because it looks like that mask thing, right? Which I don't even know what it looks like in real life. That's just kind of what I remember, right? But I don't see kind of that, distinctly on there. So,
Mhm.
um,
Right. For this one, I just didn't remember like what lymph node that the right ovary would drain into. So another guess.
okay, so I'm gonna keep this real simple for you too. Okay, let's talk about the lymphatic system in general. Okay, like I said, I'm all for the big concepts to get you more questions in one, right?
Mhm.
So where do lymph nodes in the body usually drain according to?
Just their region.
Sure,
Or
region's good, but what do they follow? What do lymph nodes follow? Do you know what vessels they follow by any chance?
uh not exactly, no.
No, that's okay. The venous system.
Okay.
Okay, they usually drain the venous system. Okay, so the reason why I'm trying to mention that is if you think of any organ, the lymph nodes are going to travel with the veins or that drains that organ.
Okay.
Okay, so does it make it? I'm hoping that makes it a lot easier, right?
Right. Hmm.
So if they're asking, giving you an example, right? I mean, I'm bad. Well, neck anatomy, I'm really good at because that's my field. But let's talk about something that I don't know. Like, let's say, I don't know, like a skin cancer of the forearm, right? So, I don't know that area super well, but I would assume that the lymph nodes that drain that skin cancer is going to be the veins that are in the forearm in the anterior component. Does it make sense what I'm trying to say?
Yes.
So you can just follow it that way, right? So that it's less because if you do it kind of per memorization, that's going to be very difficult, right? You got to memorize, every single little thing, but now you have a generalized idea of where lymphatic strain, so you can kind of work your way from that,
Okay.
right?
Mm.
Okay,
So
we're this here.
for this one, I knew it was something to do with like endocytosis, but I mean, that didn't really help me narrow down the choices in this
Okay,
case.
yeah, this one I think this is mainly a memorization thing, right?
Right.
Actin filaments, right? So phagocytosis is dealing with actin filaments is kind of what you have to know. Unfortunately, I can't give you too much here to understand, right?
Mhm.
Sometimes you just have to memorize some of this stuff.
Okay. So for this one, I also changed my answer.
Okay.
Um, but what I was initially thinking was the main one or main sentence in here was that the sum of the magnitudes of the S wave and lead V2 and R wave and lead V5 was greater than normal.
Mhm.
So that kind of told me that maybe that there was more um pressure or more contractility in that particular region
Okay.
that could potentially cause like hypertrophy. But yeah.
Okay, so going here again, right? Let's go figure out kind of what is our diagnosis, right? So
Mhm.
ejection fraction 45. It's a little bit lower than normal. There's no regional wall movement or valvular abnormalities. ECG shows magnitudes X, Y, and Z. Okay, what is the most likely changes in this left ventricle compared to normal? But the blood pressure is super high, right? So in your mind, you should be thinking whenever you have, really high blood pressure that your heart has to work into. The way I think of it is like now your heart is like a bodybuilder, right? So the only way to push past that mean arterial pressure, right, or the systemic vascular pressure, right, or resistance, right, whichever kind of to push past this because the blood pressure is so high, right, the resistance is high, so the left ventricle gets very very thickened. Does it make sense?
Yes.
So you get left ventricular hypertrophy. So what's the difference between left ventricular hypertrophy versus HOCM? HOCM. Hypertrophic cardiomyopathy. You know the difference between the two?
I think the HCM would be, it could be caused by genetics.
Okay, that's one. Okay. How I guess my question is anatomically, what's the difference?
Oh, anatomically. So I think HCM is like more to do with that interventricular
Yeah.
portion. Yeah.
So I want you to kind of be able to draw this out. So HOCM is going to be kind of this thickened intraventricular septum, right?
Yeah.
Okay, just down here actually. Okay, and left ventricular hypertrophy is going to be the whole concentric thickening, right? And this
Mhm.
is going to be in parallel. Okay, which makes sense, right? In a sense, right? The muscles are going to be in parallel concentrically, right? That's how it gets thick like that. But then if you have dilated cardiomyopathy, it increases in series. Does it make sense?
Yes.
And that's why it's dilated but thin. Okay, that's how I remember it. But yeah, so going back here, this comes back to again diagnosis, right? Did you know the diagnosis with left ventricular hypertrophy?
I did.
Okay,
Um,
good. So if that's the case, then I'm saying you're 80% there. Okay, getting that diagnosis, and now you have to just tack on, you increase sacromeres in parallel. That's all. You see what
yeah.
I'm trying to say? And then you kind of move on because that's how you want to learn it. Okay. But
Mhm.
then talk to me about HOCM. What happens in HOCM if you're talking about a pathological standpoint?
Mm, in terms of like how it's caused or
No, like for instance, if you were to, you know how the answers are here, increase in sacromeres, et cetera, et cetera.
oh,
What is it? Yeah, what does it the biopsy look like?
uh, let's see. I'm not sure if it's on here or
No, it's not going to be on here. So it's
okay.
going to be in a disarray, right? Okay. If you kind of there are probably other words that are associated with it, but hokum in a pathological standpoint, it's like it's disorganized. The fibers are very disorganized. So just so you know.
Okay.
All right. Okay, work me through this one here.
Okay. So I saw that she had a fever, swollen left knee, unable to flex, leukocytosis as well, and PSR was elevated.
Mm-hmm.
So um, I knew it was some sort of swelling, but I think the leukocytosis, for some reason, pointed and the fever pointed me more towards like a microbial causation.
Very good. Yeah, I like that so far.
Yeah.
So
So then,
why did you choose viral, I guess, is my question.
yeah, I don't know.
Okay, okay. So
Yeah.
let's work through this. Okay. So I'm gonna keep doing this repetitively, right? Because of course, you might be tired of my voice, but I'm trying to get you into a habit, right? What is the most likely diagnosis? Read through this, right? I'm like, okay, infectious in nature. 7-year-old girl brought to the physician because of increasing severe pain during the past 12 hours. So I know it's a pediatric patient, right? And it's an acute issue, right?
Mhm.
Left knee pain last 12 hours. Temp is 102.3, so high fever. So in my mind, it's infectious in nature until proven otherwise on a test taking standpoint. Tachycardic, respiratory rate is normal here. Blood pressure relatively normal. Examination shows tender, swollen knee, unable to be flexed because of pain. Hematologic study shows leukocyte count of 35,000. So in my mind, it's in her blood. So she's septic in my mind, right? And of course, ESR is super elevated. So in my mind, right, I'm not thinking it's juvenile. I'm not thinking it's Lyme disease because Lyme disease, you have a bunch of other issues too. But you have usually polyarthritis, so multiple joints, and you have heart issues, etc. Rheumatic fever, right? That's usually because of strep, right? Is it strep?
Yes.
Yeah, it should be strep, right? So you have to have some kind of, strep infection, sore throat, etc., right? Septic arthritis, right? That fits here, right? So a joint that has bacterial that has spread to the blood, yeah. So she's septic arthritis. Virosynovitis, right? That's usually pretty minor, right? You might have inflammation. You only have maybe a mild fever, but definitely you're not going to be it's not going to be in the bloodstream. You're not
Right.
going. Does it make sense
Yeah.
clinically how you work through that?
Mhm.
Okay, perfect.